Good morning. Hello, my name is Alexis Rodriguez. I think, or I can say hola, y'all. That's Puerto Rican Southern for hello. So anyway, just wanted to welcome everybody to the Georgia chapter of Myasthenia Gravis. We are glad that everybody is here. I'm going to introduce the board and let Jennifer give us some updates and go through the agenda that we have. We have two great speakers that I'm looking forward to here. But more than anything, I'm just happy that everybody's here. It's good to see some faces that I have not seen in a while and some that I see on a frequent basis. So for those of you who do not know, I'm the vice president of the chapter. I also lead the support group here every month, and I'm just, again, happy that you're here. I'm going to introduce Jennifer Fawcett, who is the president of the chapter, and let her go through a little spiel here. Let me introduce the other two. Yeah. To my right, I have Ms. Reba, who is the treasurer of the chapter, and also is here faithfully every month for our support groups. And to my left is a beautiful lady. Brownie points. That's Catherine Rodriguez. She's the secretary of the chapter, who also happens to be the mother of my 3 children and my beautiful wife. So, and of course, Jennifer. And there she is.
Hi, thank you, Alexis. So let me just reiterate what Alexis said. Thank you so much. We're excited to see this many people and to see the group growing, and hopefully we can reach out and be there for you and answer questions, provide support, and then also to reach out to other people. As Alexis said, I am on the chair of the chapter. I'm also on the national board of the Myasthenia Gravis Foundation. Just wanted to let you know about some things that are going on and that we have. Hopefully everybody has heard about the MG registry. It is the first registry or scientific-based registry for myasthenia that we're trying to develop. You can get to it through the foundation's website. I would recommend filling out or printing out kind of the initial questionnaire. It is long, unfortunately. Just sort of basic information that it asks. And then once you register, you'll receive updates every 6 months, or they send out new questionnaires to try to update it. And it is a patient registry, so it is up to the patients to kind of report things. But it is also intended for scientific research. So I encourage everybody to join. Also, there is the MyMG app for smartphones. You can get it on the iTunes Store or Google Play. And it started out with kind of surveys that you could do to kind of keep track of your symptoms. They have also updated it to include a list of medications to avoid, so to provide more information. We're continuing to add to it. I think it's been translated to Russian, something like that. I think they're also considering other languages to make it available. I'm being told I have to speak into the microphone. I was hoping to avoid that. So the MyMG app is out there. Download it, and hopefully you can use it and it'll be beneficial. Also, thinking ahead, getting ready for the next MG walk. We have had one of the more successful walks in just the 2 years that we've had it, and both years have been great in terms of the number of people who have been involved. and participated, and then also for funds raised. Last year we had it here at the church. Very thankful to the church for allowing us to have it here. As we're getting ready for next year's, the 2015 walk, it's tentatively planned for March 15th, again on a Saturday morning. If anybody is interested in helping to plan that and to volunteer and help with everything, please let us know. We're also looking at locations. The first year we had it at Piedmont Park. This year was here. If anybody has any suggestions, ideas, please just let us know. We've been in contact with Rich, with the company that's running it, and so hopefully we'll have more details about that. Also, the next annual meeting for the foundation is April 28th through the May 1st in San Diego. I think a couple of people were able to make it this year to the meeting up in Philadelphia. It is geared for the patients. We have doctors who are there to do presentations and to speak about what's going on, research, treatments, information. And it's also a great time to meet other people with myasthenia, to connect and to build support networks. Some other things that are coming up, we're trying to do another webinar, or we're trying to start a series of webinars, informational. We had one, I think it's been maybe a month or so now, on just MG 101. I think the next one we're trying to get set up is pregnancy. And so, just be on the watch for that. If you are not getting emails from the foundation, let us know, or go to the website and you can sign up to receive the emails to get information about what's going on. You can also get there's an e-update that is sent out with articles and research updates. There's also the Foundation Focus, which is the mailing, the print newsletter. I think there's a copy of it back there. Actually back there's a lot of different pamphlets and information. I think there's some pins and awareness bracelets if you haven't gotten one. So definitely go back and check that out. Let's see. I think a lot of people, or hopefully, have seen the provider manual. It's pretty thick, that is on the foundation's website, but it's detailed information, different areas, nursing, drugs, treatments. Working on an iBook version of it, so that we have an updated version, and you can have it on your iPad. So there's a lot of exciting things, a lot of new things going on. We also have the Atlanta Area Support Group, which I believe most everybody, I think, has been here or been to the support group. We meet here on the first Monday of each month at 6:30, except for July and September. So no meeting September 2nd, I think it is, coming up because it's Labor Day. So the next meeting will be the first Monday in October. If anybody is interested, I think, in starting other support groups or volunteering in any other way, please let us know. We would love to have your help. It's not just running support groups. We would welcome help with contacting people, writing newsletters, different things. Pretty much if you have an idea and you want to volunteer to help out, to do something, to raise awareness, let us know. We take any and all volunteers. We appreciate our volunteers very, very much, because without it, we couldn't do what we're able to do. Especially, let's see, there's Miss Reba. Thank you very much for all of your hard work for lunch today. Thank you, ExcellaCare. I think they brought desserts. Great. My favorite part of it. So thank you guys both. Thank you also very much for Alexis and Catherine for all of the hard work that they do. Some of our other volunteers, Bert, Denora, for sending out information packets. Michael for helping run the website. Okay, let's see, there's some general stuff. Make sure we have cell phones turned off so that they don't go off in the middle of our speakers. We do have two speakers, Sherry Hudson and Dr. Miller. So Sherry is an IVIG nurse, and then Dr. Miller does the thymectomies, right? Yeah, and he'll be here later. So for some of you, as some of you know, I'm an attorney. So here is my legal sort of disclaimer. With our speakers, please, they can't give personal advice. If you have any questions, general questions, but please, don't ask about your specific situation, because they're just here, to speak and to provide general advice. They can't give you individual medical advice. So there's my legal plug for that. I think that's it. Alexis, can you think of anything else? Anybody have any questions? No? Okay. Do we want to, Sherry, are you ready to? I don't have my. Are we a little bit early?
Yeah, we're about 10 minutes early, but we're good. We can get started.
Yeah. So turn it over to our first speaker.
All right. Don't get too excited. I'm not the speaker. I'm just going to introduce Sherry. My name's Todd. I work for a company called Excelicare. We're a specialty pharmacy that specializes in the IVIG. I guess it was about a year ago, I contacted Alexis, and he was telling me about the support group meeting, and my background was hospice. I didn't know much about MG. I'd never heard of it, to be honest with you. I started coming to the meetings. I think I've been to 11 of them now, so I feel like I'm an honorary member. And one of my goals, after talking to Alexis, he said, I really want to grow the meeting. So one thing that I've been doing is I've gone to most of the neurology departments in Atlanta. We designed some pamphlets to talk about the meeting. My goal is to grow it. MG doesn't have enough support locally. And Alexis, I just want to give you a round of applause for what you do, you and your wife, and all the volunteers. Without you, no one would be here today, and we wouldn't be meeting. I wouldn't have learned it as much as I know about MG, and you help everyone, and we all appreciate it. I just want to get up and say thank you. So Sherry's one of our nurses with Excelicare. Like I said, we specialize in the IVIG. If you do have any questions, it's hard to give a general answer that covers everyone. It's almost impossible. Everyone's diagnosis, although it might be MG, it's unique to that individual, kind of like your insurance plans. I know I've worked with quite a few of you on insurance plans, things like that. If you have questions at the end about insurance and you'd like to come sit down with me and talk, I'd be happy to explain some things or research some things for you. But we want to be a resource for you in reference to the IVIG. I know things are confusing with insurance and drugs and things like that. So that's why we're here. And I'd like to introduce Sherry. She's going to go over some of the IVIG and kind of what we do, 30,000, view of what IVIG is, what we do. We do it in the home, where it comes from. I'm sure she's welcome to questions, and I'll turn it over to you. Thanks again.
Hi, I'm Sherry Hudson. It's so good to be with you here today. And I have to say, well, you can probably tell by looking at me, I'm a little nervous, but I do know I'm just very passionate about the nursing care that I give and taking care of folks like you and helping you try to do more things that you like to do. Some of my patients, they still work every day, and so when I can give them the medication that helps them to do that, it makes me feel so much better. And sorry, I'm getting shaky. Anyway, I have to say what brought me into the nursing field was my husband. We met when I was 14 years old, and he was 16, and then he went to the Air Force. And at that time, I just couldn't stand him, really. But anyway, he's just quite the character. So when he was in the Air Force, he was in an accident that paralyzed him from the waist down. So when I was in high school, I knew I always wanted to do something in the medical field. And being married to him, I thought I need to go learn more about what is happening with him so that I can maybe better help him. And so that's what brought me more into the nursing field. So, and that has helped me bring it along. He may not like how many hours I spend doing it, but he gets my attention too. So I'm just grateful to have learned that and be able to help him. And I like to welcome some of my support that came with me. Cindy is a nurse in our Birmingham area. We're both from Alabama. I'm in the northern area. She's in Birmingham. And I just became nurse manager over the southeastern region, so I'm glad of that. And this has allowed me to come and be with you all today. And I understand so totally what the support group is about and does for you all. And it's wonderful that you all are here to support each other. And that nothing more important than that. So I'm thankful for my friend Cindy. And then also Amy, she is a full-time nurse now in this area. So it would be wonderful for her to be able to, see some of you if we'd give the immunoglobulin, IgG, and she could be your nurse. It's a very bubbly person, so I'm thankful to have her here too. Anyway, our company is Excelicare. I've been working there 4 years now, and I started out as an infusion nurse, and we give IgG. Do you all know what IgG is? Most of you, some of you get it, I'm sure. I'm not going to ask who, but IgG is immunoglobulin. It's an immune system booster, and it helps you fight antibodies. It gives you antibodies that block the unnatural attack, because sometimes when you have an immune disorder, it makes it want to attack your own antibodies. So the IgG helps block that. And it gives you more energy, can help you ambulate better, and lead you to be able to do more things that you want to do. Some of my patients say they can't believe how much more energy they have, and they're able to do more than they used to do. Our Excelicare's pharmacies, they have different places in the United States, and the one that I work out of is in Kansas, and I'm sorry. Then we have different pharmacies in Pennsylvania, Louisiana, California, just all over. But it allows you to receive your treatments in your home rather than having to go out to an office or an infusion center. So you can be in the comfort of your own home. You can wear your pajamas. You can sleep in your bed, and you can sit in your own comfortable chair and be comfortable and get your medicine, because you'll get pre-medications. Most people do before they receive the treatment, like Benadryl, and that makes you sleepy, so that makes it hard to drive to and from. And some of the side effects of your medications that you may take that you will be more comfortable dealing with in your own home, so that makes it easier as well. And you're not exposed to different infections that other people may have if you would go to the office. Sometimes we can deal with that in daily life, but with this being in your own home, you're more protected there. You can have your family with you to be there with you and have you be your support system as well. And you can have the same nurse for each visit. Instead of every time you would go to an infusion center, it might be a different nurse, or you go there and say you get there 8 o'clock and your treatment may not start till 11 or 12, so you're waiting around for that. Usually an average treatment could take anywhere from 2 hours at the most, maybe to 6, depending on your dose. So you can get it done in your home. You can get it done in convenience of your time when that you're able to get it, and we work around schedules. And Excelicare is unique in that we offer a care exchange research study that kind of tracks how the medicine is working for you. And we just collect data that gathers questions that you would answer. And research study with your permission is not something you have to do, but it helps the doctor to be able to maybe diagnose better or change the amount of medicine that you're getting. Maybe you need a different dose. So they can look at this data and see, well, they may need just a little bit more and change your dose, or they may not need this much. So it helps track that, and it's totally participatory. But Excelicare is patient-centered. That's the one thing that has kept me working with them, because they believe in the patient. I believe in the patient, and we're there to be there for the patient and what they need to do, and we want to support them in every way. So I am open to questions. Anyone have questions? I'm sorry, I feel like I didn't do very well, but I'll be glad to answer any questions that you have.
How do you guys manage side effects?
I'm sorry.
How do you manage side effects? So if I get IVIG from you when I call and Amy leaves and I'm having side effects.
Right. Well, and that's another thing. Thank you for saying that, because our nurses and staff are available. Yes, sir.
Repeat the question after each person, please.
Thank you. She wanted to know how you manage side effects, like say after Amy leaves and she's having a side effect. So you can always call Amy. You can call a nurse on call. We have nurses on call 24/7. Also, when Amy's there, she will teach you things to do, how you need to hydrate before you take the medicine and during and after to keep you from having these side effects. And also, she will help you afterwards to say, well, maybe you could take some more Tylenol, depending if the doctor has ordered that for you. So we're always there if you need help with that.
And the nurse stays for the entire infusion.
Thank you. We're there monitoring you the whole time. If you're having a little bit of trouble, we'll stay even afterwards till you feel better. That's what we're there for. Always. Yes, sir.
Medicare told me that I cannot have it at home. I can't have it at a doctor's home. I gotta go to an infusion. Why is that?
Each insurance company is different.
Medicare, I'm talking.
Medicare. Maybe Todd could answer that better for me.
So the question was, why does Medicare not want to cover this in the home? It really depends on if you have a supplemental insurance as well. Anytime you're doing anything in the home and is dealing with your drug, that's billed under Part D as in dog. If you're going to the hospital and they're giving you the IVIG, that's billed under Part B. So there is a difference. As Sherry was saying, each plan is unique to the individual. So some Medicare plans are actually Medicare Advantage plans, Humana Advantage. There's so many different kinds of Medicare. The best way, if anyone's getting infused in the hospital or infusion center, don't assume you can't get it at home. We're the company that researches that for you, and we give you the option so you can choose. Now, if you've had a company research it and they say the only thing you can do is go to the hospital, more than likely that's true for your case. But there's so many physicians and patients that are under the impression if you have Medicare or Medicaid, it's got to go to the hospital. That is absolutely not true. What is true is you need a company to research it and let you know what your options are. And that's what we do. When I talk to a doctor's office, I tell them my job is to find the best home for the patient. That may mean I can take them, that may mean the hospital, infusion center, or perhaps another company. But our job is to research it and let you know what benefits you have with your insurance.
And he said he gets nervous talking in front of people. He does very well. Anyone else? Yes, ma'am.
Do you know how dosage is calibrated?
How dosage is calibrated is her question. They base that on your height and weight, and the pharmacy calculates it like that. It's a certain, well, the doctor orders the dose, let's just say 0.4 grams per kilogram. So you're going to get that amount per kilogram of your weight.
Why I get a lot. You gotta have a little humor.
That's right. Humor's good for the soul. Yes, ma'am.
Kind of a newbie question, maybe it's a silly question, but what's
No.
the difference between IgG and IVIG?
Difference between IgG and IVIG. IgG is just the name of the medicine, the immunoglobulin, and it's given IV. So they're they're the same. IVIG. Yeah, and that's not a silly question. Yes, sir.
I go to an infusion lab right now, and each time we run blood work. How do you deal with that?
All the doctor has to do is, I'm sorry, I forgot to repeat the question. He goes to an infusion center and they do lab work each time. He wants to know how we deal with that. We do lab work. The doctor orders it, and we have what's called a lab in the box that they send with your medicine every month. And we draw the lab. We have FedEx come and pick it up, take it to the lab, and they analyze it, and then it's sent. The results are sent to your doctor. Very easy. Don't have to go to the office to get it done.
Okay, there are other companies that do not do that.
You're right. She said there's other companies that don't do that, but we do. This is the thing with Excelicare. Pretty much the doctor gives the order saying they want you all to have it, and we take care of everything else. We're patient-centered. That's what we do. Anyone else? Yes, sir.
I was wondering if you could maybe provide some insight into other treatment options. Say IVIG or IgG hasn't been as successful as treating. What other options have you seen?
He's wanting to know other treatment options. You know, each case is individualized, and like she gave the disclaimer at first, I can't really say everything, and of course that's based with what your doctor has prescribed for you. He needs to see you. He needs to do the testing and see what is best for you. There are medications and sometimes that work with the IVIG. They work together, and some work better for others, for some better than others. Yes, sir.
What's in it? What's in the composition of the medication?
What's in the IG? It's antibodies made up from different donors. It's a plasma that has the antibodies in it that help your body fight against and attack where your body wants to attack your antibodies. These give you the antibodies to block that, and it's a plasma and protein. Yes, ma'am.
Has anybody done any research about the possible preservatives that are used in the IVIG, I guess medication itself? Because I'm sure there are different preservatives to keep it stable, and is there maybe a possibility that maybe people may have a reaction to those preservatives?
She's asking about preservatives. I'm sure there's been research. I mean, this is regulated through the FDA, and you know, I know there's been research to that. I can't say what exactly they have done. I can't say. I'm not really sure. Thank you, Cindy.
I know just a little bit. I know that the different brands of IVIG, like there's Gamunex C and Gamma Liquid and Panglobulin and Caramine, all those, they go through different processes, and the newer ones seem to go through more processes, I guess, because they've had more research. And when I first started IVIG, which was like 11 years ago, Gamunex C was the Cadillac, is what they called it, the Cadillac of IVIG. Well, now that's not necessarily true anymore, and there's been multiple new ones come out. We do have patients that, if they don't respond well to one, like, for example, if they don't respond very well to Gamma liquid, they keep having side effects no matter what we do, and we change the pre-medications, pre-IV fluids, all that kind of stuff, and they just keep having problems. They'll change them to a different brand. One of our nurses actually receives IVIG herself, and she does not do well with Gamma, but she does great with Gamunex. So a lot of times they just need to change the brand of medication that you're on. And that study that Sherry was talking about, it doesn't like study the preservatives, but it does study what doses people respond best to. Some of the other autoimmune diseases that attack the nervous system more so than the muscles, they respond to much higher doses than MG patients even have to have. So that study helps develop the standard of care for MG or CIDP or whatever, what doses do best for different diagnoses. And I don't know if maybe one day that might even show what, that a certain drug, a certain brand might work better for a certain group of people. I don't know, but that study is out there, but that's all I know about the preservative things.
But that's a very good question.
There are lots of brands. There are several brands. As you know, with most medications, there are lots of companies making medications. So there are a lot of options, and we try to kind of turn ourselves inside out to find out what is the best cocktail, so to speak. You know, are you going to need, like Cindy was mentioning, do you need pre-hydration other than just oral
Yes, ma'am.
And that's part of it. That's gonna be, finding out for those of you that maybe are not getting it or going through it now, that's part of it, is figuring out what you specifically need that's gonna get you the best benefits of this therapy. And it will be individualized.
Would y'all ever heard that call was the snowflake disease?
Yes.
See, support system.
So with that study, and it's tracking how IVIG works, is that available anywhere, or if we're not going through
It's
the company, or?
it's exclusive to Excelicare. Anyone else? Yes, ma'am.
Kind of a follow-up to the last questions. What makes each of the different brands different? I mean, it's pretty much the same treatment.
Some of it is the processes that it goes through for purification, because I remember when Gammunex C first came out, and don't quote me on this, but I think it's chromatography is what the C stands for, because it went through an extra process that the other medicines had not gone through before.
When you say process, what do you mean by
Like
process?
purification processes,
Okay.
like I guess.
The manufacturing part
Yes,
of it.
yes, the manufacturing,
So, but is it pretty much the basic formula across the board for the IgG, but it just changes based on the processing?
Yes, and you mean you don't mean the dosing?
No, I'm
you
just talking
mean
about the medication
product
itself.
Yeah.
And why you've got
The product
such.
itself is usually, is pretty much the same across the board, like you said, except for after I said that, I was thinking about, like, we're talking about Gammunex C and Gamagard, those are 10% solutions, and I don't know if anybody in here is on the 5% solution, which means, with the 10%, it means you have 90 parts medicine and 10 part fluid. With a 5% solution, maybe I said that. Maybe I said that, yeah. But the 5% solution is less concentrated, which means you have more volume. You'll have twice the volume, like 30 grams of Gamagard is 300 cc's or ml. 30 grams of, I think it's Flevogam, is 600 cc's. So it'll take longer to infuse it, but if you have if it's less concentrated, you tend to have less side effects.
Right.
And you can still use a 10% concentration and add your own fluid to it to dilute it yourself. And we have patients to do that too.
And even go at a slower rate, which also helps too. See, that's why the nurse is there to monitor you through the whole thing, so that if we need to go at a slower rate, then we can do that based upon if you have reactions. Anyone else? Yes, ma'am.
What's the difference between the IgG and the plasmapheresis?
The plasmapheresis is when you're going into the hospital and it's almost like dialysis, and it's a more to do with your blood. The IgG is giving you the medicine. The plasmapheresis is more kind of like cleaning the blood. More involved to it, more side effects. Yes, sir.
Quick question. Was there a name for the diluted IgG?
A name for the diluted IgG.
I know one of them is Flevogam, and
There are several out there.
we don't use those near as much. The standard is usually 10%, but and what's the new one, the Plexi, something they just told us about?
Gamaplex.
Gamaplex is also 5%.
So many different names, it's hard to keep up with them all. Anyone else? Y'all have helped me. Y'all have had some good questions, and that's helped me a lot. I appreciate that. Thank you. Anything else that I can tell you? Yes, sir.
I've always asked, hydrate before, during, and after.
Correct.
Why?
Because it helps slow down the side effects or even stop the side effects, and it also flushes your kidneys to help flush it through your system and help it to work better. And the medicine can tend to dehydrate you a little, so you always want to be hydrated, and it makes everything work better, and it makes you feel better also. And some people, the main side effect is a headache, as you probably know, and being hydrated helps with that tremendously. Yes,
Can you
ma'am.
just talk about some of the other standard things that a nurse would do when they would come in, like do you guys do vital signs before and after?
Good question. See, I had that wrote down and just went right over it. You're just wonderful. But yes, that's part of our monitoring when we're there. We do your vital signs. We start every 15 minutes for an hour. We're monitoring your blood pressure, your temperature, your heart rate. And this will tell us if you're having a reaction or not. Because typically if you do, your blood pressure is going to go up. You're going to start getting a headache. And so if we're monitoring that, then we'll know, well, they might be starting to have a reaction, so we'll slow it down or keep it at the slower rate. And then after the first hour, we'll monitor every 30 minutes for an hour and then every hour. Usually by the time we get to every hour, you're nearly done. And I have to say, it's rare that I see, I see people get a headache once in a while and they'll get it after. It's typical that they can do that, but it's rare that I've not seen a very bad reaction, I have to say. We also have an EpiPen that comes with our medicines. Forgot to mention that. Anyway, so if you would have a reaction to the medicine, we can give you the EpiPen, and then of course we would call 911 to help you with that. But thank God I've never had to do that, and I hope I never have to. So, but we are prepared if we have to do that. Yes, ma'am.
Would you suggest taking the medicine out of the refrigerator before you? How long?
Good question. You don't have to keep it in a refrigerator. There are 2 dates on the medicine, expiration dates. One is for if you keep it at room temperature, because you can, 77 or above. No, 74. Thank you. And you don't want it to you don't want it to get too hot, but take it out of the refrigerator typically an hour before. Some people just like to keep it in there, and that's fine. There's an expiration date for room temperature and one for keeping it in the refrigerator, and it does last longer, but the expiration dates, if you look, they're a year or more out. So totally up to you. If you get cold easily, keep it room temperature.
I'm glad you said that because I usually get up at 5 o'clock in the morning to take it out of the refrigerator.
Oh.
So it's room temperature by the time the nurse comes. So it's good to know.
Bless you.
The night before.
Right. Yes.
This whole time I could have slept that extra 3 hours.
There you go.
Also, just a nurse tip, we're always trying to give our patients tips. I had a patient that started his first IVIG, and he didn't eat. For some reason, when you go for tests or you go for something, they always say, don't eat anything after midnight. Eat. Okay?
Yes.
Nausea is another thing. We don't want you not to eat. You don't need it on an empty stomach. It doesn't go to your gut directly, so eat.
That's another benefit of being at home, because you can eat whenever you'd like. You can have your supper or whatever while you're getting your medicine. So it's just so much easier. Yes, ma'am.
I mean, I feel like a stupid question, but it's a blood product. So is that why it has to be given intravenously, or is any movement towards making it a capsule or anything like that?
Well, let me tell you this. It doesn't have to be given intravenously. I mean, it can also be given what's called sub-Q, which is in the fatty tissue. We do that also. It's little needles that you would put in, and you can give it yourself. So that's another avenue. But now as far as PO, I don't know, or by mouth, I should say, I don't know of anything with that. But it works best peripherally, and that's how it's given.
Do you do much sub-Q?
We do some sub-Q, yes, in Alabama, and there's some here too in Georgia. There is.
How does that work?
It's given once a week. The patient can give it themselves. It's 1 day a week, and it goes in, absorbs slowly at a slower rate than the IV does, and that's why you give it once a week, because usually,
Usually it's not a shot. Yeah, it goes through a pump.
right, it goes through go ahead.
I was gonna ask you a question about the sub-Q. So typically sub-Q is just for the smaller dose, correct? So if a patient needed 100 grams.
Well, they divide that weekly,
Okay.
but typically, yes, it is for the smaller doses.
So we also work with immunology patients, infants, children. they are typically on the sub-Q because it's such a small gram. They might give, 3 grams a week. Whereas in neurology, any kind of neuropathy, MG, CIDP, they're getting larger grams. So the IV is much quicker, even though she mentioned earlier that much quicker could still be anywhere from 2 to 6 hours. So if you are getting I'm not sure what the cutoff is of grams that you wouldn't even want to look at past to get on sub-Q. I just want to,
Right.
get your thoughts on that.
And you have any thoughts on that, Cindy?
Yes, I know that, there's a new thing that's coming out, and I just heard about it a couple of months ago, and I can't even remember the name of it, but it's a volume, or a tissue expander that they're actually mixing in with. Hizentra is the #1 brand of subcutaneous infusion, and they're mixing the Hizentra with the volume expander or tissue expander, and you can give it in one site, and you can give your whole volume in one site, and it temporarily expands your tissues to hold that dose, and then it shrinks back down as you absorb the medicine, which is just amazing to me. Because typically with the subcutaneous for adults, you have 3 to 4 needles. They're the little bitty needles that are like smaller than insulin needles, but they're 3 or 4 needles, up to 6 needles. I haven't usually have people like that, and you put them like in different sites, like across your belly or on your thighs. And we teach you how to do that, and it's once a week, and usually it takes 1 to 2 hours once a week. And what that does, is like, say this is your IgG therapeutic range. When you get IVIG, you spike way up here above, and then you come down. We try to get you again right where you're getting low, but you have these big peaks and big valleys. Well, with subcutaneous, it keeps you, we get you right here, and you stay right there, at an even keel. Now, it's FDA approved for people that have Todd was talking about, the primary immune deficiencies, because those people will get an infection in between their big dips. I don't think it's FDA approved for MG yet, or the CIDP patients, the neurologic patients, but they are starting to use it in them some for people that, especially that have a lot of side effects with the IVIG, or people that have terrible IV access and don't have a port for whatever reason. They are starting to use it in people for that.
And there is a study that they were doing looking at sub-Q IVIG in myasthenia, St. Louis University. I think it's still going on. It was very limited sites, but they are looking at it. So it hasn't been, it's not a common practice for myasthenia. Yeah.
And we actually come to your home and teach you how to do that for several weeks in a row until you're comfortable. Then you do it on your own, and of course you can always call later if you have any problems, but you become independent with that.
It's just important to know that you just have options. That's the main thing. Yes, ma'am.
She just mentioned port. Do people who get IVIG have port putting?
Some people do. It just depends. Mainly we give it through a vein. People who have trouble with their veins, where you have trouble getting their veins, which I have to say we've all become so good at it that we can get pretty much anything. We strive ourselves on that, but yes, some people do, but not everyone. It's not typical, let's say. Anyone else? I think my time's about over. Appreciate you all having me here, and I have thoroughly enjoyed it, and we do have some pamphlets back on the table if you want to get those and look at those. And I'm available if you need to ask questions after. Be glad to. Thank you.